Okay, and we are live. I'm going to give it a few more seconds for people to make their way in. And welcome everyone and good afternoon. Welcome to our latest installment of the COVID-19 webinar series for 2020. It's been a heck of a year and a heck of a webinar series thus far. Today we have Dr. Charlene Brown, my personal friend and favorite public health physician, who will be talking about aerosols and COVID, what home care clinicians need to know. My name is Nussin Weisbord, and I am the moderator of today's webinar. I work with LHC Group in the home health arena, and I am a current board member and immediate past president of MNCA, the Maryland National Capital Home Care Association, who has worked so hard to bring this webinar series to you. Along those lines, I wanted to thank MNCA for making this possible, as well as the Maryland Emergency Preparedness Network, which was brought to you by the Office of Preparedness and Response in Maryland from the Department of Health, through a generous grant through the Department of Health. And if you want more information about MNCA or the EPN, their websites are right here on the slides for you, and the slides will be sent out after the event. As well as Dr. Charlene's company, CNA Simulations VR, which you can see the website on the slide as well. Dawn Seek, our wonderful executive director at MNCA, her email is located on the slide too. If you have any questions about home care, home health, or DME in the state of Maryland or DC, she's the person to go to. As far as our wonderful COVID-19 webinar series, we have just one more event after today, and that is going to be tomorrow. It's called Let's Talk CNAs with Angel Jackson and Wendell Anderson. They are the co-hosts of a talk show for CNAs by CNAs, and they'll be talking to us tomorrow at 7 p.m. Eastern Time. So be sure to register and catch our last webinar of the year. And with that, I would like to introduce today's featured speaker, our very own Dr. Charlene Brown. Dr. Charlene is a physician who's worked extensively in public health and spent a lot of time working on the HIV pandemic, and certainly over the last few years when she moved into the home health arena, she was able to use that to her advantage. When I think pandemic, I think Dr. Charlene Brown, and I think you'll agree with me when you're done here. I'll leave this up for a second just so you can read her extensive body of work, but she comes with a great deal of experience, and we're very grateful for her and glad to have her here today. Before I turn it over to Dr. Charlene, I just want to start with a poll, just so we can get to know you in the audience a little better. So if you'll take a few seconds, look at your screen and tell us who you are and why you're here today, that would be much appreciated. I'll leave that up for a few more seconds. All right, I'm going to post the poll results. Okay, so it looks like we've got agency office staff, nurses, and therapists as the primary groups. We've got some agency owners and caregivers. Okay, well, we know who's here. Now we're going to turn it over to Dr. Charlene. With no further ado, I give you Charlene Brown.
Thank you, Nussin, for that great intro. Hi, everyone. It's good to be back in a different role. And today I'm excited to talk to you about COVID and aerosols, what home care clinicians need to know. So let's review what we'll cover today. First, we're going to take a snapshot of the pandemic in Maryland. We'll review some of the COVID transmission routes, but with a very specific focus on aerosol transmission, airborne transmission, and understanding how aerosols are different than droplets. And so for most of the pandemic, we've been hearing about droplet transmission, but more recently with the mountain of evidence supporting airborne transmission through aerosols, it's time for us as an industry to really look at how we can translate that evidence into how we deliver home care. So why do aerosols matter for home care? And what can you do differently to reduce airborne transmission in client homes? So let's just start with that snapshot of Maryland. So right now, we have nearly 250,000 cases in Maryland since the start of the pandemic, but our test positivity rate is 7.68% as of today. Now that's really high. That's up from like under 3% at the beginning of October. And it is consistent with the national trend of just elevated test positivity rates. So in Texas, the test positivity rate is much worse. It's on the order of 17%. In Pennsylvania, it's over 30%. But in DC, it's under 4%. And so we have this wide range of situations where the rates of COVID are going up in some places, they're on the way down in other places. Maryland, if we were grading Maryland on a curve, we wouldn't be doing so badly. But from an absolute standpoint, any kind of testing positivity rate greater than 5% means that you're in trouble and that you have a significant amount of community transmission of COVID. And that's why we've seen the governor introduce new restrictions trying to help us get back into a position where we can start flattening the curve while we desperately wait for the vaccination to become more widespread. So let's, and by the way, while the testing positivity rate was 7.68% like today and yesterday, if you look at it over the past 7 days as an average, it's really 6.2%. We can also look at this graph and see that, July, August, September, October, even early November, we weren't doing so poorly with the occupancy of ICU and acute hospital beds. But right now is a terrible time to get sick because, as you can see, the slope is going up and we are nearly at capacity. So the gray line shows the total number of beds that exist. And then the pink line shows the number of acute beds and ICU beds. And so if you look at the purple and pink lines and add them together, we're kind of really close to the gray line. And so it's important to do everything we can to reduce transmission right now because our hospital systems don't have the capacity to manage further increases in positivity and illness. So I'm not going to spend a lot of time talking about transmission routes because really you've heard it a million times. But what I will focus on is this idea of aerosols versus droplets. And so the aerosol scientists, the physicists that do aerosol science, call the droplets ballistic droplets because they like go out of your mouth or your nose and then they hit the ground pretty quickly. They're big and they drop fast. And that's why you need close proximity to be exposed to COVID transmission through droplets. That's where that sort of 3 to 6 foot rule comes from, with the idea that they are unlikely to travel that far if you maintain social distance. But aerosols are like smoke. They're very tiny and they travel very far. So if you look at this graph, this picture, you can sort of see this like fine mist of mayhem. And these respiratory droplets, they can stay in the air suspended for hours and they can travel well past 6 feet. And that's why airborne transmission has become such a hot topic lately because the 6 foot rule doesn't actually protect you from aerosol transmission. That's why we have these super spreader events. That's why we have all of these cases where people who were distant from the infected person still were able to contract COVID. So it's like smoke. Airborne transmission matters for home care for a bunch of reasons. First of all, anyone who's doing home care is breathing and talking, and that produces a ton of aerosols, just breathing. Aerosols with infectious virus can be suspended in the air for hours, as we know, but it can also accumulate in the room. So when you're visiting and working in someone's home, you're in a confined space and breathing and talking over time, especially as it's getting colder, there's not necessarily a lot of ventilation. So that those aerosols are suspended in the air and accumulating over time. Aerosols are more densely concentrated at close range, as we can see again from this image here. And asymptomatic individuals emit mostly aerosols. So as you're thinking about caring for your patients who don't have symptoms and your staff that may not have symptoms, they may actually be transmitting COVID, and they may be transmitting COVID through aerosols, even if they're asymptomatic. And given the community transmission and the high rates of test positivity, which is likely an underestimate of the prevalence of COVID, it's important to assume that everybody could have COVID. Everybody. So home care has lots of enclosed spaces, prolonged exposure. Most shifts for a caregiver are usually at least 4 hours. And especially as it gets colder, most houses may have inadequate ventilation. So the probability that an infected person will transmit virus to others is highest among household contacts. And so I was thinking about how to think about caregivers. Your nurses, speech therapists, physical therapists, social workers, they're going to visit their clients in their homes, but they're not really staying there for a 12-hour shift or an 8-hour shift. Our caregivers, household contacts, should we think about them and their risk as the way we think about risk for household contacts, because they're spending such prolonged amounts of time inside people's homes, sharing the same air, exchanging aerosols. I think that's a question to really think hard about, specifically for the CNAs and caregivers who are doing long shifts in close proximity to older adults. So you might think, well, aren't masks enough, right? Like, we have masks. I'm sure all of you are having 100% mask compliance. Masks do reduce airborne transmission, but as you can see from the graph, like, you really need everybody to wear a mask. And I've been moderating these webinars for a while, and I'd say every second webinar, there's usually a question about, well, do we really have to wear masks? Or if the older adult doesn't want to wear a mask, do we really have to insist that they wear a mask? Or, like, there's always a question about, do we really need the masks? The answer is absolutely, unambiguously, and emphatically yes. Just look at this gross, disgusting picture, all these potentially infected aerosols hitting your staff in the face, or your staff, God forbid, transmitting COVID to your clients. It's a disaster waiting to happen. You can become infected according to the CDC, literally just in 15 minutes of talking with an infectious person. And the aerosol scientists, they actually think that that's not evidence-based. They think you can actually become infected in 5 to 10 minutes, even if especially if you're less than 6 feet apart, even if you're wearing a mask. So there's this case of a security guard in a prison guard who actually he interacted with several prisoners who were infected with COVID. They weren't wearing masks, but he was wearing a mask, and I think also had on PPE. But he still contracted COVID, but he didn't spend 15 minutes with any individual person. Cumulatively, in terms of his proximity with the people who were infectious, it added up to 17 minutes total. So you can become infected through sequential exposures to multiple people who are infectious. A mask is essential, but it is absolutely not 100%. And we're going to go over that actually. So this is from an article in the British Medical Journal. There was this analysis that has many reasons to critique it, but if we use it as kind of a general a general way of thinking about risk in low occupancy settings. And so I'm considering home care to be an extremely low occupancy setting. If you have no face coverings and contact for a prolonged time, so these long shifts that caregivers are having, even if you're silent, you still could reach a medium risk. If you're speaking at the lowest occupancy level, it's still a medium risk activity. Shouting or singing is even worse. Now with a mask, still in these low occupancy settings, as you can see that even with a mask, if you have contact for a prolonged time, you can still find yourself in the low to medium risk category. Masks are essential, but fit matters. There's this really, if we have time, I'll show it later. There's this really interesting video that shows 3 different mask types. There's a surgical mask, an N95 mask, and a secure fitting cloth mask. And it just shows, and the mannequin head here is breathing, essentially. It's artificial breathing. And you can see all of the, you can see this haze around the person that's breathing, even while they're wearing a mask, right? So even though the surgical masks are really good, you can see all of this smoky material around them. The same thing with the N95. And what was really interesting is that the theoretical contaminated air, the aerosols, were flowing backwards. And so do not stand behind anyone with an ill-fitting mask. The best fitting mask was the one that had the least leakage. So again, you see all these people kind of half wearing their mask, not covering their nose, or you can see these gaping spaces. That is not protective, and just stay away from them. So what else can you do as a home care agency? Masks matter, so upgrade your masks, right? You can either consider the types of masks your staff are wearing and upgrade them. You can revisit mask fit and technique with staff and clients, update your masking policies with staff and clients. And so you should be having both your staff and your clients wearing masks at all times during care. And there need to be consequences for noncompliance, both for your staff, but also for your clients. And that might mean losing some business, but the risk is significant, especially now when there's such high rates of community transmission, that you really have to become very intense and careful about mask use on your teams so that you can optimize your ability to reduce the risk of transmission in the delivery of care with your clients. So properly fitted N95 mask can filter out 95% of aerosols. Some of you may be using a N95 mask with your staff. Surgical masks offer 70 to 80% protection. And then if you're going to use a cloth mask, use one with multiple layers. So single layers have really low filtration efficiency, but if you use 2 layers or more of fabric, you can actually increase the efficiency quite dramatically, especially if the cloth mask is close fitting. And so if we think about COVID, this symbol here, this is measuring the microns, and so 0.5 microns is actually smaller than the size of COVID, and so you can actually do quite a bit with a cloth mask, but again, the gold standard for masking remains the N95 mask when properly fitted. So combine masking with other strategies to reduce the risk of indoor airborne COVID transmission. The risk of infection drops if you have multiple people in a confined space and you have them wearing masks, you have some distance, and you include ventilation. So we're going to talk a little bit about ventilation. There's so many ways to address ventilation. And I think that's through the lens of introducing new strategies for reducing the risk of COVID transmission in the delivery of home care. I think ventilation is the new frontier, where there are a lot of interventions that can be considered that may not have been considered previously before there was significant attention to the degree to which there might be airborne transmission. Some people actually think that airborne transmission is the dominant mode of transmission for COVID. So we have, open the windows. There are things you can do with HVAC. You can strategically position fans, air purifiers, especially ones with HEPA filters. There's rules for CO2, carbon dioxide analyzers, even humidifiers. So both the EPA, the Environmental Protection Agency, and CDC have guidelines. And let's go through some of their recommendations. So from the EPA, increase ventilation with outside air. Now, some of this may be difficult to do, for safety reasons, right? You might have older adults with dementia who, if you open all the doors, will go for a walk unbeknownst to everybody else. But from a ventilation standpoint, opening multiple windows and screen doors, especially at opposite sides of the house, is an important way to increase ventilation with outside air. If you have a whole house fan or evaporative cooler, window air conditioner, outside air intake of the HVAC system. And for anything related to HVAC, you really should consult with an HVAC professional to really understand what's possible with your HVAC system. Operate a bathroom fan when the bathroom is in use. And if you can just keep it running all the time, that's even better. And if your home happens to have a heat recovery ventilator or an energy recovery ventilator, then operate it. Now, I'm talking about this as though it's your home. These are the kinds of things that you can actually talk to your clients about and educate them about how they can actually keep themselves and their loved ones safe by addressing some of the ventilation opportunities in their home while they are having caregivers or caregiving professionals from your agency visiting and taking care of them in their homes. Second category of recommendations from the EPA is improving natural ventilation. So that cross ventilation by opening multiple windows and screen doors, opening the highest level windows if you have a multi-level home and the lowest level windows at the same time can help to increase ventilation. For double hung and even single windows, you can open the top sash of one window and the bottom sash of another to encourage ventilation. Multiple fans can be used to push air out of one window and draw it in from another. But again, I would recommend checking the guidance to make sure you're not inadvertently setting up fans so they're blowing potentially infectious air at people. You actually need to position them to push air out of the window, not draw it in, and circulating air between people in your home or in the homes of your clients. So HVAC, honestly, all of these recommendations for HVACs, I say talk to an HVAC professional. I'm sure they're getting hundreds of questions about ventilation and COVID right now. And so you really want to talk to a professional. But the things that you can talk to them about include running the system fan for longer times, making sure you have the right type of filter, so it's a higher efficiency filter, open the outside air intake, and again, looking at the energy efficient air to heat exchanger, heat recovery ventilator, and other things. Now, to be frank, I have no idea what those things are, but for those of you who know about HVACs, do that. Let's move on to the fourth category of recommendations. Now, this is something that's actually tangible that you can actually wrap your arms around and do. Air purifiers with HEPA filtration, you can buy those online. You can go to a store and buy them. They're everywhere. And the EPA reports you can help to decrease airborne viruses in your homes. Just like fans, you don't want to blow the air directly between people, but it's a step that you can introduce along with myriad other steps that will help to combine together in ways that reduce the risk of transmission in your homes. It's not enough by itself, but it is a powerful tool in our armamentarium of tools against this virus. Finally, this goes into this category of if you have it, use it. So if you have a whole house or portable evaporative coolers, that's one way of bringing in air from the outside and using air to cool the air. It can help with ventilation with outside air and potentially increase relative humidity of your indoor spaces. But again, the EPA has really important recommendations, but some of them will require engaging with professionals who can help you figure out if they are relevant to you or to your clients in their homes. So what are some other environmental factors to consider? Dry conditions actually favor COVID survival. You might think, oh, well, then we should absolutely just get a humidifier. But the survival of COVID on dry conditions doesn't really impact transmission when it's happening in close contact. It really matters for transmission at a distance. Dry conditions do make us humans more susceptible to infection. So honestly, if you have a humidifier, if your clients have a humidifier, you might as well use it. Just keep the humidity below 65% and above 40%. And recognize that way more effective than humidifying your space is actually to use that HEPA air cleaner. There are guides online. If your clients don't want to spend money on a HEPA air cleaner, you can actually make your own, like wired.com. There are a bunch of websites that have like the do-it-yourself tools on how to build your own pseudo like fan filter system that can actually help with air purification, even in the context of the COVID pandemic. So to review, what are the options to reduce COVID transmission through indoor air? And again, these are things that are important for home care. When you think about other types of long-term care, whether in a facility, when you're in a facility, that becomes a public building mandate, and there are all kinds of much more advanced strategies and tools to improve air exchange within buildings. But those things don't apply in people's homes, which is why for the home care industry, there's an important opportunity to look specifically at what are the types of things that can be done in an individual family's home to help protect that person in your care, their loved ones, as well as the people that are in your charge, the caregivers and nurses and physical therapists and occupational therapists and speech therapists, all the people who are going out and into people's homes. There are opportunities to partner with families to see what you can do to reduce the risk of transmission to them and from them. So make sure mask wearing is consistent among your staff and among your clients. Make sure the fit is secure for clinicians, caregivers, and clients. And this secure piece is really important. Work with clients to ensure proper ventilation. This presentation will be recorded and put on the website, on the EPN website, as well as the slides. And so you'll be able to find those references to the EPA recommendations and CDC recommendations that are in the slides. Limit the number of people in the home. And so if you're caring for someone that's planning to have a huge holiday party, you might actually opt out. It's really not in the best interest of anyone, including that family. It's really a dangerous time this holiday season. And for better or for worse, there are a lot of people who aren't heeding the recommendations to stay home and remain with the people in their own household to reduce the risk of contracting COVID or transmitting COVID. When it's safe, outdoor activities are always better from a ventilation and airborne transmission standpoint. And of course, never stop wearing masks, staying as far away as you can, recognizing that in the delivery of home care, it may not be possible to do that. But there are some elements of care that can be done 6 feet away, and to frequently, constantly wash your hands. So I'm going to stop there and see if anybody has any questions. This little flyer on the right is just it's a tool that can help you think about what is important to avoid in terms of preventing COVID. So avoiding crowding, being indoors with low ventilation, close proximity, it's a risk. And so most of your staff are engaging in that risk all the time because they have to deliver care. So since they're already engaging in high risk activities, it's really imperative to do everything you can to mitigate the other risks, including the long duration, no unmasking. Just don't let your clients pressure you into the unmasked universe. And honestly, even if your clients like to sing, like just reduce the singing and no yelling and so on. So let me just pause and stop and just see if there are any questions. Thank you so much for listening.
Thank you, Charlene. That was fantastic. I put on my mask just to make everyone feel a little more comfortable.
Awesome. Maybe I should have worn a mask for the presentation just for emphasis. But
yeah, well, that's what I'm here for. That's quite all right.
Okay.
That was great, and there's a lot of information there to learn from and really consider. Some of the things that I noticed, and I'm going to take this off now so you can hear me better. Some of the things that I had never considered the bathroom fan idea as something that could work you know, while a caregiver is in a client's home. And that's an easy, quick fix that someone can, you know, encourage their client to do.
Mhm.
It sounds like, you know, continued use is probably best, but that's a great call. I did want to ask, because we covered some masking, you know, some different mask options, but I didn't hear KN95, and I know it's certainly not an N95. My question was, is the KN95, where does it fall in terms of, you know, mask strength? Is it better than a surgical mask? Is it better than a cloth mask? Like, where do we stand on the KNs?
That's a great question. The KN95s, especially when there were PPE shortages, a lot of facilities, a lot of providers relied on KN95s as a temporary substitute for N95s. If you think back to way back in the summer when we had a speaker on N95s, he highlighted that the KN95s just mean they don't meet the U.S. Specifications for approval as a N95 mask. They haven't been manufactured to meet specifications in this country, but they have been manufactured to meet specifications in other countries. And so I can't give you a specific percentage of protection, but they are high. They're believed to be on the higher end, but maybe not as good as N95s. It just depends on where they're made and who made them and in what country they may have been approved.
Okay. Okay. That sounds good to me. And then I'm just reminding people that if you have any questions, please feel free to drop them into the Q&A tab on the bottom of your screen, and we can get to them one by one. You do have some comments. You've got a thank you, Dr. Brown, very good presentation. You have another from Linda, who says, excellent presentation, thank you. One more thing that occurred to me that I'm going to ask, and feel free to defer. But if you have any insight into this, especially for the home care world, that'd be great. I know we recommend masks for everyone, you know, clients, caregivers, across the spectrum. The question is, when it comes to a client that is, let's say, you know, with someone with COPD or CHF or other underlying breathing issues, where a mask might exacerbate their breathing trouble, is there a way to keep the client unmasked and still stay safe as the clinician?
I'm assuming you're talking about cases where there's been a medical provider who specifically said that it's unsafe for this person to wear a mask. Because there are a lot of people who think they can't breathe or they're having trouble breathing with masks, where it's really not true.
Right.
So I guess I would wait. I would start with whether or not it's a psychological barrier to wearing a mask or an actual clinical need. But yeah, in that case, because everyone could have COVID, it becomes a matter of risk that provider should probably optimize their own masking, try to limit their proximity to the client for things that don't require proximity. That's going to be really hard for a caregiver, but might be possible for, let's say, a speech therapist. But it's not, there's no, unless if the person doesn't have COVID, then great, right?
Right.
You're not going to get COVID if they don't have COVID. The problem is there's just no way to know. There's literally no way to know because, you know, the testing, the false negative rate for COVID tests is astronomical. So, and someone having tested negative is meaningless in terms of believing that they don't have COVID. Because
Right.
of that, there's just no way to know. So it's a risk.
Gotcha. Well, thank you.
Yeah.
We do have we do have a question. Deborah asked that for patients with respiratory conditions, such as asthma, COPD, etc., how do you best determine the mask to use?
That's a great question. Honestly, just if you're talking about your clients, I would rely on what their provider has recommended, and short of that, a really good cloth mask with multiple layers should be fine. You know, like I think it's not, you don't have to provide each client with an N95 mask, for instance, but making
Right.
sure they have any kind of barrier is helpful, and having a really well-fitting cloth mask with at least two layers is would be sufficient. That's how I would answer that question.
Okay, thank you.
Yeah.
And Ada says, thank you for the presentation. And she put a little plug in. They're currently looking to hire a self-motivated care manager. So
There.
contact Ada.
There you
Um,
go. That's very creative job
yeah,
advertising. Go Ada.
absolutely. We've got another question. Linda asked, is there a good source that lists aerosol generating procedures that our staff should take extra precautions when performing?
Uh, I don't know one offhand, but I can look. I would actually, um, yeah, I don't know offhand.
Okay. Okay.
Oh, go ahead.
No, sorry, go ahead.
No, I think Deborah Jackson has a question.
She does indeed, yeah. Deborah asked, does the agency provide humidifiers, purifiers, et cetera, for those clients that are unable to afford them and might be in homes that don't have adequate ventilation? And if so, what type should the agency provide and why?
Interesting. I guess it depends. Like, I don't, it's up to the agency whether or not they have the resources to provide purifiers and humidifiers for clients that are unable to afford them. There may, depending on the agency and depending on their own internal resources and depending on whether or not they want to provide them, educate their clients about what is available, or even assist them with some of the do-it-yourself options for creating fan filters that can serve as air purifiers. But I don't personally, it'd be interesting if anyone is with an agency that is providing these types of tools for their clients, just drop a line in the chat so we can know about it. I honestly think at minimum agencies can consider as they're doing home assessments and as they're evaluating the safety of a home, both for the client and for their staff, I think this during this phase of the pandemic, this could be integrated as part of your assessment to just evaluate what's available and consider integrating this into how you would counsel families, particularly if you're going to be delivering care to those families.
Right, that's a great option. I like that. Yeah, when you're doing your safety eval and talking about the fall, you know, the fall hazards and having that carpet there or whatever it is, you just add humidifiers to it. Linda asked, can you address guidance for washing masks and reuse of disposable masks? I know this comes up throughout the pandemic.
The reuse of disposable masks. So it's interesting. NIOSH, the National Institute of Occupational Safety and Health, actually put out a series of recommendations specifically because of the PPE shortages at the beginning of the pandemic about reuse of masks, specifically reuse of N95s, but also reuse of disposable masks. So before there was a pandemic that killed hundreds of thousands of people in the US, there was nobody talked about reusing. You didn't reuse masks. They were one-time use. You used them and you threw them away. In this context, especially if people are starting to encounter shortages again, I would refer people to that guidance, but also recognize that there's an information base about how long the virus can survive on different types of material. And so when you think about, let's say a surgical mask, the virus isn't going to live, even if someone was exposed to somebody with COVID and was wearing their surgical mask, if you put that surgical mask in a plastic bag and wait, you can actually wait out the virus, right? So you can allow the virus to die and then reuse that mask. But the risk of reuse is in that fit, right? So the more times you manipulate that metal bar that goes across your nose, the more you're risking a poor fit. And so reuse is definitely on the is can be necessary during this unreal world that we're living in with during a pandemic. But I
Not
would,
ideal.
it's not ideal, but it is where we are. And so reuse of disposable masks becomes a matter of putting them aside and waiting out the virus, waiting for it to die. In terms of washing masks, um, I I mean I would wash them every single day. If this is about somebody washing their own masks, I would wash them separately. And I don't actually know the specific guidance on washing masks, but the reality is there is guidance on everything. And so either CDC or NIOSH will have guidance on this as well. And I can include those links. I can add those links to my slides before they're posted.
Okay, that'd be great. Thank you.
Sure.
Another question for you. Should clients who refuse to wear a mask be advised of how doing so increases their chances of contracting COVID from a caregiver, even though the caregiver is masked?
My opinion,
Please.
absolutely. Yes, with informational materials and potentially some videos, like whatever you need to do, whatever you need to do to illustrate that masks are essential, they're important, and I think they have prevented us from, they have helped to reduce the amount of death and destruction from this during this pandemic. But yeah, masks have a percentage of protection, and especially when confined in spaces where there's poor ventilation, and where it's really difficult to know if somebody's positive because the false negative rate of tests are so high, then absolutely, yes, I agree. I think so.
Excellent. I agree.
Um,
With all my medical knowledge and background, I agree.
Thank you, Nathan.
Oh, absolutely. Cleopatra has a question. For this question, that would be good reason to get orders. She was saying that for that question, that would be a good reason to get orders for a social worker. I'm assuming that's in terms of being able to offer guidance to the client.
Yeah, absolutely.
Yeah,
Especially now in the winter. One
right.
thing I didn't mention in my presentation, but which is exquisitely obvious, is also encouraging your staff to get vaccinated, and encouraging your clients. Like the next wave, the first wave of vaccines prioritized healthcare workers, including those working in home health. And so I'm hoping that for many of you on the call, you've either already been vaccinated, or your staff has been vaccinated or is in line to get vaccinated. And the good news is that the next wave of recommended priority vaccinees, people to be vaccinated by the CDC, includes adults over the age of 75. And so that will include many of your clients. And so I'm actually excited for this industry, because coming soon is a world in which more and more people will be vaccinated, and there'll be less and less risk. Despite vaccination, though, all of these recommendations about masking, ventilation, and following the long-standing recommendations for social distance and hand washing, like all of that will still remain, but our overall community risk will go down.
Right. And then, I mean, the idea is that ultimately there will be a return to normalcy, maybe? I know we're not there yet, and I don't want to get ahead of ourselves with the vaccine, but is there a tipping point at some point that once enough people are vaccinated, then we can kind of do away with that? Or are we looking at masking and hand washing for the rest of our lives?
I hope. Well, yes to hand washing. Just like always wash your
Right.
hands.
I guess that makes sense.
Well, yes to hand washing. Actually, it's actually a good habit to reduce transmission of many things. But
Right.
in terms of like a lifetime of mask wearing, I do hope we've had a cultural shift, actually, because I imagine, no one knows the future. I imagine a future in which we don't need to wear the level of protective garments that we do now. But nobody actually knows. We don't have a lot of data yet. The vaccines are phenomenal. They're so effective relative to other types of vaccines. It's mind-blowing, but we still don't know how long that protection lasts.
Right.
We don't know if there's a future in which we'll be getting annual vaccines. We don't know. COVID is now here, and COVID elimination, if we were to think about eliminating COVID, that's not in the near-term future. That's not going to happen this year or next year. What we can hope for is to get to a point where enough of the population is vaccinated that the day-to-day risk of contracting COVID becomes negligible. But it might be a future like the flu vaccine where
Every
the
year.
virus continues to circulate and we need to get vaccinations. Unlike the flu vaccine, COVID isn't seasonal. I mean, it's worse in the winter, but it's pretty bad in the summer and the spring. And so the flu vaccine has definite seasonality. And so we know, okay, each winter we should get the flu vaccine. If we have to get repeated cycles of this vaccine, which we don't know yet, because it's only, there's about 2 months of data. We don't even know what that cycle would be. Would that be every year, every couple of months, every 5 years? Who knows? So is there a future where we'll be wearing masks less? Yes, but I hope there's been a culture shift where people wear masks when they're sick.
Right. I hear that. Lots to look forward to. Okay. Paula's got a question. She's curious to know if any agencies have changed their policies regarding staff administering CPR, since aerosols can spread via CPR. I guess if any agencies on the line want to drop their experiences into the chat, that's great. And Charlene, do you have anything you would want to add to that?
I've not heard of any agencies changing their policies regarding administering CPR, but there are, I doubt there's any evidence on the degree to which they prevent COVID transmission, but there are like tools that you could equip your staff with so that if they do have to give mouth to mouth, they can actually use a barrier in the process of doing that. So I don't know. I'm a physician. I can't imagine if somebody needed CPR. I couldn't imagine not giving it, even with the risk. So I hope agencies haven't changed their policies, or if they've changed their policies, they've upgraded them to try to create a safer interaction with the delivery of CPR. I just can't imagine saying you're not going to do it. But investing in tools to make it safer if it needs to happen, I think would be a really good starting point.
Okay, thank you.
Sure.
And someone asked if the presentation will be accessible to share with others, and I'm happy to handle that one if you'd like. The answer is yes. The slides and recording of today's webinar will be sent out to all registrants, as well as hosted on the Maryland EPN website, which I guess if you registered, you'll have links to that anyway. So stay tuned. It'll be sent out probably within the week, and you will get a link to it. Let's see. I think that's it for now. I don't see any questions currently. Would you want to go back to that clip you said you had?
Oh,
just because we have a couple minutes left, if you want to play that clip you had mentioned.
Absolutely. Okay. Give me a second.
Sure. And anyone else in the audience, if you have any questions, please feel free to put them right back in the Q&A, and we will get to them after the clip. I do think I learned a great deal about my HVAC system, though. That was an unexpected bonus.
Oh, I can't actually do it. Hold on. Let me just go straight to Google and play it.
Thank you. I know we can always just send it out in the slides, but I figured.
When I played it before, my husband asked me if I was watching a science fiction movie.
That's always scary.
I'm definitely not standing behind anybody wearing a mask ever again. There you have it.
Wow. That's a little scary, I'll tell you what. Yeah, they really got the mood music nicely done. Yeah, just a great reminder again of how important, even with masking, how important the fit of that mask is, and then how important it is. I guess that's why all the grocery stores and supermarkets have those, spots on the ground telling you where you should stand when you're waiting in line. You don't want to be too close to someone. It could be that with a good mask, standing behind a person is actually more potentially dangerous than standing in front of them.
It was, yeah, I was pretty shocked by that video.
Wow.
The amounts of smoke that were moving around. One other thing I didn't mention was there are these carbon dioxide analyzers that you can buy pretty cheaply that show you, like if you assume that carbon dioxide is a measure of the amount of air that's been breathed out by people, you can actually keep track of the air quality using carbon dioxide analyzers, and you can buy them over the counter. There's lots of material and guidance about how to interpret that data, but in terms of the do-it-yourself category of things that can go in there with the makeshift HEPA filter and the
Right.
buying over
Depending
the counter
how brave you are.
So many choices.
That's
but
great.
yeah, I'd
Thank
say Deborah wants to know if you can have certificate of attendance.
Yeah, I was just gonna ask you that.
Well, we haven't given out any to date, and so we're happy to verify attendance. If you send us an email, just go ahead and send it to info@mdemergencyprepnetwork.org.
You should be able to, if you reply directly to the webinar registration confirmation or any of the reminders, it should go to the right address.
Yes, and so we can verify your attendance if you go ahead and send us an email. And with that, why don't we go ahead and say thank you to the amazing sponsors that we've had.
The wonderful people that make this all possible.
Exactly. So usually we have, I think I'm way behind in the slides, but if we fast forward to the very end of the slide deck, we will thank our sponsors one more time. Thank you, Maryland Office of Preparedness and Response and the Maryland Department of Health. Thank you, Minka. Thank you, EPN crew. That includes Don Seek and Jan Carisi. And thank you, CNA Simulations VR. We are going to wrap up at this point, although I think there may be a final question.
Jan was commenting that she can take care of the verification. If people email her, she can verify that they did indeed attend the webinar.
Fantastic.
Thank you,
All
Jan.
right. Do you want to close it out, Nelson?
I do, folks. Well, let me start with Charlene. Dr. Charlene, thank you so much for this wonderful presentation. Thank you all in the audience for joining us. Jan, thank you very much for all you do behind the scenes. Dawn Seek, our fearless executive director, thank you. And don't forget to join us tomorrow for our last COVID-19 webinar. And have a great night and a wonderful week, and enjoy the holidays. Stay safe.
Okay. Bye. Thank you, Nelson. Thanks,
Bye,
everybody.
guys.